Okay, good morning. If you guys will check out the board here in just a second, let me share a screen where we can pull that back up. I'm going to put this on. I want you guys to look. Don't look at the date. I didn't adjust that part, but this test guidance, it's under content. And it's actually, I don't know if any of y'all have clicked on it or not, but it's really very good. Morning, Diane. I was telling them about under your content, there's a tab called Test Guidance 1016. Don't pay any attention to the date, but the info would be good. And it's, I know we still have to cover some of the stuff, but I'm just going to show you, like, it's, if you want to work on kind of prepping for the test, or a good way to make sure you're going through the chapters and noticing some of the right stuff, if you take the time to go through this, it'll help you a bunch. And what I think that we're going to do is do the test next Tuesday. So we're going to try to do 6 and 7 today. We'll talk about some of this information that's on here. So in between today and next class, you can kind of get familiar with some of this information, and that's sort of along the lines of what we'll talk about as far as review. Now, Lonnie, I know that you are not here. You will be watching this via Zoom, via YouTube or however we do it. We will figure out a time for you to take your exam also on that day. Okay, so since we're going to try to do 2 chapters today, I'm going to jump right on in to chapter 6. So I'm going to share screen again, and there we go. So we've moved in the book into managing operations is like section 2. We talked all about managers and what they do and things like that, and we're going to keep building on that. But now we're talking about actual operational techniques that, as a manager, you're going to be doing. So this chapter is talking a lot about technology, and as you know, technology is constantly evolving, changing, growing. I've seen so much change. You know, I'm older than you guys are, but I've seen so much. You know, I had the first cell phone that was in a bag in the car. You know, that was how it worked. It was about that big. You know, it would barely fit under your seat, and it cost a gazillion dollars to get. And I remember getting like the first microwave when they came out. I mean, not the first, but when they first came out, we got a microwave, and I thought we were hot stuff, and we could make hot stuff in our microwave. So it worked out good. But anyway, now, you know, you can go to Walmart, get a microwave for $60 because that's not the thing anymore. You know, gaming systems, they change. PlayStation 1, 2, iPhones. What are we up to now? 11? I wasn't even sure who has the 11. Okay, that's what I figured. Let's see, every time there's a little change in technology, there's usually some benefit in it. So we see that not just in our everyday lives, but you see it in the workplace as well. When you're serving as a manager, you're going to have changes in technology that are going to affect how you do things. So just on here, we're going to run through this information because it's a good synopsis of the chapter. Again, it does not cover everything. It does not cover everything that will even be on the test. That's kind of why I put together that other sheet when I taught this class before, to kind of give you a little closer guidance than even through running through these. But the management of information technology is referred to as informatics. That's just strictly a definition, know what the word means. And what it does is you want to do systems that deliver the right information to the right person at the right place and time and right away. So, right, if you kind of you can remember some things that you're looking for when you're talking about IT and, information technology of any sort that you're giving. You want it going to the right person, the right information, nothing that's wrong, right place and time, and in the right way. The most effective way to get your points across. See, okay, I have to remember not to use the clicker in here. It is 1 touch equals 2 on it every time. So a technology plan, the purpose, as it says here, is to support the achievement of the organization's mission and goals. That's basically everything we do. That's kind of what the support is all about. Uh-oh, hold on. My microphone's acting weird. Can you hear me now, microphone? Okay. Okay. Apparently. Oh, wow. Surely that wasn't me. All right. Not sure what happened there or what's going to happen moving forward. I may have to talk to her personally. But as far as your technology plan, there's usually, it's a strategic plan, and the best way to meet the organizational needs is to get a committee together. And everybody knows that companies love committees because you can spread the wealth, and everybody, I do think that they're a good way to get things done. You get a lot of different ideas from different people. If you're talking about say Merit Health System that offers a lot of different options for, healthcare, then you want to have people that have expertise in all those different areas to give their input as far as their strategic plan for their area. So you would need someone from different disciplines in the room. Telehealth. This is huge right now because, I'm sure you've seen it, heard it. It's a big boom right now because of COVID. There's people that don't want to go to the doctor for a sinus infection, that they normally would. And it's a way that they can actually reach, speak to a physician, get health, get medications that they need, their health care through distance. So it's nice. It's just distance health care. A lot of it, because you're dealing with somebody through a computer and through distance, you have to share, there's a lot of just conversation back and forth because obviously there can't be as much direct observation. So they're going to have to ask you lots of questions. So it's very patient health related as far as, they find out a lot of information about you in telehealth. Because if they're doing it right, they really have to probe deep into what you're telling them to understand what's going on. But that's definitely a situation that's booming right now. On the previous slide, when I think about this technology plan, I think of it including, just think of like the HESRM, Health and Exercise Science website. it's something that we've worked on before and we're going to look at in this class later on once we get some chapters under our belt. You want your technology to be streamlined. You want it to be easy to follow. If you're doing marketing, you want something that's going to stand out. And those are the kind of things that, like when I was talking about having a committee, you're going to have some people that are, you know, if I was on a committee for the Halloween party, no, that's not a good one because I'd be pretty good at Halloween. But if it was just say a 4th of July party here, then they probably wouldn't want me on the decorating committee because there are people that are more creative and would pay more attention to how to make it look exactly right. That's not my strong suit. That's another reason that you have committees, because you have people that are better at different pieces. But I just wanted to kind of bring it up that, you know, the information you're given, you want it to be clear, and that you have marketing as a part of your technology plan, not just, you know, health records and such. Dashboard report. Have you guys seen dashboard report lately? Does that ring a bell anywhere? On what? Where have you seen it? Yep, there's a COVID dashboard that you can see. You get emails and things on almost all the time, telling where we sit as far as COVID, how many quarantine rooms are available, how many isolation rooms are available on campus, how many active cases we have, things like that. And what it's done is, and it's relatively, I think it's pretty accurate as far as this description. An easy to read graphical representation of the current status of performance indicators. Now, we're not talking about performance when we're talking about COVID cases, but it is put together in pretty straightforward numbers. You know, this is how many active cases, this is how many are in quarantine, this is how much space we have available. There's even a trend on there showing where students are living right now, showing that there's a little bit of a trend of students moving off campus into other locations, which I don't blame them. And that's helped me a lot with my contact tracing, because students are, when they start seeing people around them getting it, they're just getting out of Dodge now. So we're not having as many close contacts, and it's helping me a lot. So, and the university as a whole. So the main key on the dashboard report is putting a lot of information together in a simple, clear format that someone can look at and make a judgment in a pretty quick manner. And that's kind of the goal of a dashboard report. Not sure why this little camera doesn't seem to be working, but it's okay. Electronic health record. That's health information specialists. They also have some other names, but they're, you know, when you go to the hospital and you want your medical records, there's people that work in that department and they handle electronic health records. They also have probably file cabinets and drawers full of real charts that they're changing to electronic health records, because that's the trend. Everything's going electronic. Partially because once you get it done, it's a much simpler, more concise way to have it. Then if you think about health records, you're talking about confidential information. And so if somebody reaches, say 10 years have passed and you have to keep medical records for 10 years, what has to happen if you have a big file on somebody this thick? It's got to be burned, shredded, destroyed, you know, if you're going to get rid of it. You can't just go throw it in the dumpster because it has all their information. And an electronic health record, number one, you're not really going to run out of room. They have infinite amount of space basically to save these things. And if you wanted to delete someone's information, say it was no longer needed, a certain amount of time has passed, you've met that gap, then, you know, a couple clicks and it goes bye-bye. So that's another benefit of electronic health records. It's just a digital record of health history. It may have, what it does, it brings in from different sources, hospitals, clinics, providers, different areas, and all that information is put into a online health record that's all encompassing for each individual. So you see where that's actually a handy situation. You pull all that, you're not having to call different clinics, you're not having to track down information. If it's all brought together already, that's a lot better. HIPAA. When I say HIPAA, is there anything that comes to mind for any of you guys? What does HIPAA deal with? One more time. There you go. That's the thing that, you know, and it's not even listed on here. As it says here, it came around in 1996. It does deal, when I think HIPAA, I think confidentiality too. Number one, you know, being on the contact tracing team, we had to go through HIPAA training, which is basically, how are you going to do this and maintain the patient's confidentiality? You know, you can't tell someone, hey, you were in contact with Cheyenne and she's got COVID. I can't do that. You know, when I talk to people, they're hesitant to tell me their close contacts because they think I'm going to tell them who got them sick if they get sick. I'm like, I couldn't tell these people your name if I wanted to. So don't worry about that. You know, I just need to know your people. And it's hard to kind of go through that process because people think I'm going to rat them out. But because of HIPAA, and the fact that it's not necessary, you know, that won't happen. The reason it started, HIPAA, when it came out, the government kind of pushed for this because they wanted all of the information that had to do with healthcare billing for federal government use, which we're talking about Medicare, Medicaid primarily that comes to mind there. They wanted it all in one spot, and they wanted it done in a specific way that HIPAA mandated. So that was the reason that it kind of got started, was because Medicare and Medicaid payments and patients, they wanted all that stuff to be done exactly the same type of information for each patient. Now it evolved into being big about confidentiality through time. HITECH, that's the Health Information Technology for Economic and Clinical Health Act. It's a lot of words. What it does, it's there to stimulate technology use in health and human service agencies. It wants, let's see, there's certain things that have to be charted for accreditation. When you have your watchdogs or the surveyors that come in to make sure that you're doing what you're supposed to do. And HITECH, that's kind of what it comes from and deals with. The Joint Commission for Accreditations of Hospitals. There's several different accrediting bodies that come in to check hospitals, outpatient facilities, inpatient facilities to make sure that they're following guidelines. And HITECH is a big portion of the things that they may be looking at when they come in to check accreditation information. So the goals of HIPAA and HITECH, which we talked about, encourage meaningful use of electronic health records by healthcare professionals, achieve significant improvements in client care. Okay, we talked about before how, in some of the earlier chapters, how sometimes people will buck when there's changes. You know, most people, when I say, do you like change? Very few people are like, everybody gets comfortable. They like the norm. They like what they're used to. So you don't want a lot of change. Now, this going to electronic health records, do you think Bessie, that's been in health records at the hospital for 42 years, was excited when they came in and told her that her filing system was going to change? She knew how to find a file from 1982. She knew it was in the back of that file cabinet in that other room in there. But did anybody else know that? No. That's the reason that we're talking about these health records. It puts things where everybody can find them. It puts them once, even though she probably bucked and didn't like that idea. Once she learned how to do electronic health records and realizes that other people are putting this information in for her and it just shoots into it, it probably has improved Bessie's life, or whatever her name was. I forgot it already. But change is once you get through the process of learning something new, getting through the change, a lot of times it truly is for the better. And that's something, since this class is about leading and being a manager and kind of leading our teams, we have to think about how when we do have changes like that, how are we going to motivate them to buy into the process? Because here, that's a good example of what truly happened. When I worked at the regional center, we had a secretary there. She's been there for a long time. And it's just like I said, she knows where every form is. She knows, if you ask her for an IBR, which is an inappropriate behavior report, she pops up, gets it out. Man, if something happened to Miss Carol, nobody would know where anything is. So obviously what they need to be doing with her right now is making her a little uncomfortable and making her get some of this stuff online, electronic, where other people can actually find it. So when you're talking about doing things online, and I'm sure, I know you guys have all seen this stuff too, there has to be data security involved. When you're making purchases online, you see things that say, transaction encrypted by SSE, whatever, you see that. Safe transactions through PayPal, this is how we do it, and it's through things like we're talking about here that keep the wrong people from being able to see transactions. The same thing is happening with health information, that you don't want the wrong people having access to that either. There's things like digital certificates that just contain information that authenticates identities of the person that's sending or receiving data over the internet. Make sure that the person getting it is correct and the person that's sending it is actually who they say they are. Encryption, when you're getting onto a website or something, there's a little box that it says CAPTCHA a lot of times, and you have to say, I am not a robot. And then there's these boxes, and you have to pick out click the boxes that don't have traffic lights in them. Have you guys all seen like that stuff? That's what we're talking about. That's encryption. That's to find out that by doing that, it knows to give you the unencrypted version, basically. If you can't pass that little test of clicking where the bridges are or where the stoplights are, then you would not be given the information in a way that you could read it. That's the main gist of what we're talking about with encryption. It changes the original form into a form that can't be understood except by the intended recipient with possession of an algorithm that will unscramble the data. So that's what you're doing. But now, that being said, I've seen some sites where all you had to do is literally click on a box that says, I'm not a robot, and it opens it up. So that's not a very strong encryption system right there. I think they need to go like second level. Firewalls, we know what that is for the most part. Electronic barriers are what firewalls are. Between an organization's internal private data and somebody being able to hack into it, see it from the outside. Firewalls keep information safe. And then backing up data and storing data, you can do that in order to not keep so much necessarily right on hand in your personal computer. If it can be sent to a storage system, you know, we have jump drives you can save stuff on, delete it from your regular computer. You know, we have much larger systems to do that also. But those are just some electronic data security issues that are talked about. Then we went into evidence-based practice, and what it comes down to, it's just a problem-solving approach to the delivery of therapeutic recreation services that integrates the following. Best evidence, you hear that a lot these days. Best evidence from research, or you hear best practices in this educational setting. That's what they want us to do, is use best practices in our teaching and things like that. That can be based on the best evidence from research. So to better yourself as a manager, leader, you need to actually do some of this, is look at research in your field, stay up to date with things that are being done, and plan things that you're going to do, say for this chapter, in even a electronic way. You want to use the best systems that are working for other people seamlessly and aren't giving them a lot of troubles. Other places that you can get evidence-based information from, clinician expertise. You know, you talk to someone who's worked directly with the patients, ask them a straight up, you know, question, well, how is this working for you? They say good, then you know you have evidence saying that, well, what's your rate of attendance since you started offering food at every event? I bet it went up. It would for me. That's asking your clinician. They are able to give you data that you can base whether or not things are working. Another thing is client preferences and values that you can base. That's evidence-based also. You can get that directly from them. You can get that from surveys, even if in like a well-written survey. If there's people that you deal with that don't want to spend the time talking, but they will take a time to take a survey home and send it back to you, you can give them a self-addressed envelope or anything like that. Different ways to get your information, but client preferences and values are another evidence-based knowledge source. So in evidence-based practice, the therapist applies the best scientific evidence to each, okay, the key here, to each customer's unique situation to make clinical decisions. So it's individualized, like we've talked about before. Everybody's unique situation. Integration of the best research with clinical expertise and client values and preferences. That's what evidence-based practice comes down to. So you take the best results from research that you can come up with and see that are effective. You put those things along with, you know, you run that information by clinicians who have good information on the population you're dealing with, get their opinions. So you're putting the previous slide all together, and that's what evidence-based practice is. The goal here is to provide the best possible program based on the available evidence at hand, and you want it to have the most desired, intended, and meaningful outcomes. That is, I'm reading you something that you all know already. That's common sense. You want to provide a quality service. You know, that's based on the best information you have, thus the best choices you can make, because that's what you have to go by. So you want desirable, intended, and meaningful outcomes. That's recreation therapy in a nutshell. Now, I know we're talking about a lot of things in this course. It is about leadership. It's about administration roles. It's about being a manager, and a lot of it does apply to other fields. But as we're going through this stuff, try to remember that we're talking about primarily in therapeutic recreation. So try to put it in that setting when we're thinking about all of these things. Indicators based on standards of practice, derived from literature, experts, and use of effectiveness evidence, which is basically research results. It can also be talking to your practitioners and seeing what results they're having. And if they're not having a lot of luck, if they're doing something and they say, well, I don't think they really like this, what are you as a manager going to say? Well, how can we make it better? What can we do to, you question in a good way to get positive changes in that situation. Evidence-based practice critical questions. So these are things that we basically ask ourselves as leaders and managers. How do we know what we do is effective? How do we actually track that? And it needs to be something that's not just in your head. It needs to be something that you can actually track. In a lot of ways, and with recreation therapy, we've talked so much about goals and objectives and how they need to be trackable. That someone could come in that's not a recreation therapist even and have a clipboard and say, if one of your objectives was for somebody to do something 7 of 10 times, 3 times a week, it doesn't take a rocket surgeon to come in and be able to mark that down. It's notable. You can check it off on a checklist. So how do we know what we do is effective? It needs to be done in a way that you can keep up with this, can document it, and can show it to someone else. So as an administrator, leader, manager, you need to have your practitioners at the end of their, this is what progress notes and things like that are for. They're documenting how the day went. And they're giving you things that can be, they can give you statistics of attendance, of people, whether or not they're being effective with what you're offering. So it just needs to be trackable and something you can keep up with. And then obviously you need to think, and now when you're basing this on, when you say evidence-based practice critical questions, you are basing this on the things we talked about, asking people that are, specific to their field, that have knowledge, looking at research, things like that. Based on those things, by talking to people that know a lot, talking to people that have tried different things, by reading about different options that we could give as activity opportunities, how can our practice and services be improved? So, that's a good way to live your life in general, is to try to, how can I improve? How can what I'm giving to people improve? That's things that we need to think about. Let's see, table 6.3, it talked about when you are, now we're talking evidence-based situations here, and it has different categories of evidence. So we're talking about evidence-based, so let's talk about those. There is anecdotal, that is derived from experience. There's testimonial, where it's reported by an expert. Statistical is built from scientific approach. There's case studies where there's an in-depth analysis, non-experimental design research, quasi-experimental design research, and randomized control trials. I'm not going to go through those. We'll run out of time. Something else that I noticed in the book that I think is good to take note of, it's on page 91, just like table 6.3. They're both good little things to keep in the back of your mind. There are, when you are looking at evidence-based practice and how you're going to choose what you're going to do, there's something called the 5 A's. And they are ask, acquire, analyze, apply, and assess. You ask appropriate questions. Then you acquire by review of literature, different case studies, things like that. Look for scientific evidence to answer your question. Then you're going to analyze that critically for validity and the ability to generalize it. Therefore, can we use it where we are in an effective way? Apply it, use the best available evidence, clinical expertise, the client's perspective, and knowledge of available resources to plan care. Again, why do we throw in there the client's perspective? Why is that important? Thinking in terms of recreation therapy. Why don't we want to just tell them what we're going to do? They may not like it. How do you want to get, are you going to have better participation, better results from someone who feels like they had a hand in coming up with what you're doing? Or someone that you just tell what they're going to do? Who's going to enjoy it more? The one that actually had some say in it. So that's important, and I'm glad that they put that in here because it's important to remember. And then at the end, you assess, evaluate performance through a process of self-reflection, audit, or peer assessment. You know, you can have a meeting with your entire group and ask, you know, how did this work? What do you guys think? As a leader, when you do that, you're opening the door to a lot of things. But, you know, even conflict, you're going to have some people, I didn't like that. That didn't work at all. And then you got somebody else that's going to say, I thought it was great. That's the best thing we've done. And so you might be opening the door for some conflict, but you're opening the door for open conversation and the feeling of a team. You know, your employees feel more important because you're giving them the opportunity to tell you what they think about what you're asking them to do. And that's important. Just like our clients, when you ask them about what you're going to do for their treatment, they feel more important when you do that than if you just tell them what's going on. So anyway, if you're making any notes, put 91 on page 91, because there's both of those two things are there, and they're good resources that you could use going forward. So as far as outcome measures, we've talked about that. They quantify data, describe performance resulting from specific interventions with specific clients. So you're getting documented results that you're going to see how things are actually working. What are your outcome measures? Outcomes evaluate if results are consistent with indicators found in evidence-based practices. So based on did our participating in this event work the same as the research that we've looked at before? You know, that's kind of what that's getting at. And then there's some different criteria here for outcome measures. Relevance, is it relevant, important, and are goals and objectives attained? Okay, I like that chapter because I think it's important, especially the first part talking about the information, because that's something that really is changing. And I'm not that old, but I've seen from when I was a practitioner starting out to now, the changes in even in recreation therapy, which is not an overly IT-based field, information technology, computer-based, I've seen a lot of changes. I've seen a lot of the way that we're doing things change a great deal. Wow, that's why the camera wasn't working. Somehow that got turned off. It probably was better off anyway. So let me share. Y'all have any thoughts, questions on that chapter? Relatively clear, kind of what it was based on. Again, make use of these learning outcomes and things, that are in the content. If you look at that stuff, if you read your chapters, and if you use that study guide before the test to prepare, it won't be so bad. If you do not, the test is going to be so bad. It will be a relatively difficult test if you don't do those things. Of just be straight up, because we're at this point, we're at the 473 level. I'm not going to feed you quite as much hand feeding as I did in 262. That's just the nature of the beast. So take a little time and go through that stuff. All right, let's talk about chapter 7. Let me share the screen again. Okay, and this one, obviously, this talks about two very important principles as a recreation therapist. Advocacy is a big one, because we are the advocate for our clients. I saw that a lot when I was at NMRC. I know you guys get sick of me talking about NMRC. That was a big part of my life, though. I was there for 20 years. That's what I, know the most about. But there's just so many things that play into these real life events. I can tell you that it's true. What we see in the book, it comes into play. What you're going to have on the CTRS exam are things that actually happen in recreation settings. A lot of times we do have to be an advocate for our clients. They can't speak for themselves. They won't speak for themselves. They don't have the self-confidence to speak up for themselves. They don't feel like they can go to certain people to tell them their needs. And if we know that, because a lot of times recreation therapy, we're their buddies. We're the ones, we do the fun stuff. They come to us and do things that they enjoy. The rest of their day, they're talking to psychologists, or, if they're depending on age, doing different work and things like that. So we're the fun ones. They're going to confide in us a lot of times. And that's where we have to realize that we have to be advocates for them, because they will tell us things that they may not tell other people. That being said, you don't want to be going behind their back and losing that trust because you're advocating without their consent. We'll get into more of that. So, marketing. We all know what marketing is. That's just trying to, that's commercials on television. What's the main commercials if you watch TV right now? Does anybody watch regular TV anymore at all? Like DirecTV or anything? Or does everybody have Netflix and stuff? I have DirecTV. Gotta love this time of election cycle. That's all that's all I'm getting for commercials right now on some of the channels. That's marketing. They're marketing themselves as candidates. Marketing is increasing the use of technology by consumers. That's a new trend that's happening in marketing. Also, you see that a lot of people, because they don't, maybe it's because of COVID, they may have lost money, they may have lost their job. So when people are making healthcare choices, including therapeutic recreation, because therapeutic recreation, when applied properly, is healthcare. Don't get confused about that. It is definitely healthcare. People are looking for value, just like they do in everything else. When you've got resources that have been cut, then you're looking for the best. You know, you want to find someone who has 5-star recommendations. You know, you want to have somebody that you've heard from word of mouth that they do a great job. They're fun to work with. They are, you know, I saw good results. Obviously, those are the things that you want. So constrained resources play a big role in people looking for the best value for their buck. We have a large diversity of client needs, you know, lots of different needs, you know, all the way up to now, some of the needs are changing because of COVID. People don't have public transportation. They can't use the park and ride anymore. They got to find a different way. I mean, you know, there's things that happen all the time that are going to change. And so there's going to be a lot of diversity in client needs. Obviously, a trend that we all know about is the growing aging population. The baby boomers are still with us. People are living longer. So that's a trend. So we're not just, if you're going to do a marketing campaign, you know, you don't want to put, I mean, there's far different ways that you want to reach a 25-year-old person and a 75-year-old person. The same marketing plan will not work for both groups unless it is one that is just, you know, love conquers all or something with no music. But if you have any sort of marketing plan that's going to involve current events, music, things like that, then you know you're going to have different demographics that you have to reach in different ways. That's basically what it comes down to. Societal and social marketing consider individual and community health benefits. So you're looking to, how can we help you, yourself as a consumer, and what we're offering, how can this benefit our community as a whole? So you can be part of the positive change if you come see us. You know, we're offering this by providing COVID screenings for everyone. We're helping keep all of you safe. Every visit to our store, you'll get 2 free masks. I'm just throwing stuff out like that, but that's marketing. And in that way, you are giving them an opportunity to see that, you know, you're addressing both individual and community health with those type situations. You're giving them an opportunity to help the community and themselves. So that's a good way to look at it. You know, you think about marketing also, and on the trends page that we just finished, it would be remiss not to talk a little bit about like Facebook, Twitter. Those are huge tools now. Dr. Lenicky, he's kind of our social media guy for HESRM. I come in every day. If I look at Twitter, he's already done 4 or 5 tweets on Twitter every day, trying to reach a demographic. You know, your grandparents probably don't use Twitter that much. Maybe they do, but you know, say my parents, for example, they're not on Twitter. They're on Facebook, and I would need to reach them in a different way again. But I just wanted to throw out that these social media platforms are a big way to use marketing right now too. So what marketing does, accomplishes organizational objectives by creating voluntary exchanges with target groups. Now that's the key. In marketing, you've got to realize who your target group is, and that's going to directly affect how you're going to market. The manager needs to anticipate the client's needs and direct need-satisfying services to a stakeholder. That's a lot of fancy words, but you're basically, as a manager, you need to say, okay, what are my people that we're going to be worked with? What do they need? You know, what are they coming to me for? What can I offer them? And then from that, you just have to direct what you're offering to what you've just figured out. You know, you've anticipated the needs. Then you market something that's going to draw people in. Now, a lot of places have a marketing person, a social media, you know, at the park commission when I worked there. John Davis was our media relations guy. He does all the social media. He puts out press releases. He would come and do, you know, if I had something big going on at the pool, when I was the pool director, he would come to me and do an interview with me and post it on Facebook. Maybe send a story to the Eagle here in town, things like that. It is wonderful if the facility where you end up has this person. If they do not, you as the head of a department, so we're talking about in this role here, you would be in charge of marketing your services. So cross your fingers that you'll have somebody who's very good at their job, and you have someone to handle that marketing and such. So it says at the bottom, need is service valued as essential by the client to meet a desired outcome like improved health. So the number one key to them is how much value are they going to get out of what you're offering them. Your marketing campaign needs to show them that you are going to be effective and they're going to get the most possible out of what you're offering. So there's two types of marketing that's talked about in here: target marketing and social marketing. Target marketing is designing services to meet needs of distinct population having common needs like clients, caregivers, and peer professionals. Social marketing considers the impact of individual benefits on the community. How does one person getting better or one person doing this improve the community as a whole? For example, improving the health of clients to help reduce lost work time due to illness. So you're affecting a large group of people when you're talking about social marketing. Target marketing, you're looking for a distinct population that you're wanting to market to. Market strategy identifies a target market and develops a marketing mix to establish and maintain a mutually beneficial relationship between you, the unit, and the target group. So the tool that the manager uses to influence the target market's demand for services has 4 P's that you can remember here, and these are important. Pretty sure this will be tested. The 4 P's: product, price, place, and promotion. So when you're thinking about marketing, obviously those are 4 very important things to look at. Your market plan. This is a strategic document that outlines the target markets, values, and strategies to establish exchange relationships. Again, we've talked about API and how it's important for recreation therapy and how it can be generalized to so many things that we do. Here we are again talking about marketing, and it goes directly into an API process. I mean, think about almost everything you have to do that involves a decision and action. It follows the API principle, basically. Like API, the manager is going to follow the process to conduct a SWOT analysis. Who knows what a SWOT analysis is? Who can tell me what SWOT stands for? Yep. Opportunities. I'm going to give you some full disclosure here. I had to look up O last night. So don't feel bad. I remembered the same three that you just said, and I actually had to look and see what O was. I was blank on it. But that's funny. That's a good thing to use as a decision-making tool. It's a good thing to use when you're brainstorming and talking in a group, because you really can get some good ideas if you use a SWOT analysis. You know, what are the strengths if we do this? And you just jot them down. What are some of the opportunities we're going to see? What are the weaknesses of doing this? What threats do we have? So you're going to develop a business profile, design an action plan, evaluate the impact of the plan. So you see right there, API in action on that slide. So here we go. In the marketing plan, your assessment. You determine your overall marketing goals, identify your target markets, what needs are there, what trends are happening right now, who is your competition, and where do we have room to grow. Those are things that are important in your marketing plan. And during this part, just like you would in individual program plans, you can develop target market goals and objectives. What do we want to get done by marketing to this group, you know, for each specific target market? Planning. In the planning phase, a manager is developing a business profile to forecast income and expenses for target market action plans. What are we going to get out of it? How much is it going to cost to market our product? You don't have a ton, and I see this growing in the future. There's not a ton of recreation therapy information out there. I think there should be more, but actually trying to market yourself and pull people in, I think there needs to be more general knowledge of what we do, how this is a real thing, and education on what recreation therapy is. And then marketing could take a different step for the recreation therapy field. So we're talking about the planning. You have to look at a forecast. You have to forecast, what are we going to get out of it? How much expenses are we going to have? You develop action plans guided by, you know, which your market position statement for a target market. You're talking about which one is most important as far as marketing to. Who are we going to be able to get the most business from? Who are we going to see more of? So in recreation therapy, you're probably going to market to special populations, specific areas, and you're going to market, say, elderly population would be the ones that you would probably have the most cost benefit by marketing those groups. You're going to have more of those that you can talk to by putting out one advertisement or one blurb. During this plan, it's going to identify the marketing strategy for the target group. It's going to include the marketing P's and the service P's. Those are the P's that we just talked about a couple slides back. Do y'all remember? Anybody remember those? Product, good. Price, place, promotion. So you can put those here as well. When you're talking about your marketing strategy for each target group, you want to ask those questions for each group that you're dealing with. So implementations, the managers are going to connect to and influence stakeholder behaviors. That's what you're looking to do. And when we say stakeholder behaviors, we're talking about who we're trying to reach and serve. They're the stakeholders. They have some stake in it because they're hoping to get benefit. Your marketing style guides and timetables help managers to present their messages. Obviously, you can look at other forms of marketing and see what's effective. You can think to yourself, what kind of marketing reaches me? You know, am I in this demographic that we're trying to reach? Does it matter what reaches me? Or do I need to talk to my grandparents and see what kind, you know, you can find a lot of information out through that. There's different strategies that managers use to implement plans. We all know about branding, logos and taglines. There's some that you can't miss. You know, everybody knows the Nike swoosh, and everybody knows Just Do It from them, you know, from years. There's so many of those. Bundling digital networks, and then something that's important is documentation of benefits and outcomes. So you need to have documentation saying whether or not things are working the way that you thought they would and hoped they would. We're almost done. We're almost out of time, so we better be almost done, huh? Evaluation and control. What happens here, see, we've made it to the E portion of API. You determine if the action plan goals were achieved, identify financial outcomes, improve efficiency and impact of your market expenditures by looking and seeing if you've met the goals that you wanted to meet. You know, have we improved our services? Have we brought in more people in this demographic? Was the marketing plan successful? By bringing in these people, did we make more money as a department? Or did we break even because we spent X amount of money to get the word out and we got 4 new clients and it equaled out, you know, or we got 12 new clients and only spent $40 for the ad. That's a good value for us as a department, you know. So you're looking at whether or not you have to look at the financial side as a manager / leader. It's a business. We put out money to try to get more people here to increase the number of people we serve to make more money. Simple, you know. So in order to do that, how can we get the word out the cheapest and spend the least amount of money possible that we can? Once you've done that, you try to improve the efficiency and impact of market expenditures moving forward. You kind of find out what's working for you, what's not, use that going forward. The manager determines if the unit is pursuing the best opportunities with respect to the target markets, services, and strategies. So is what we did effective? If not, how can we improve this? That's kind of what you're talking about at that point. And then I talked about advocacy and what we had to do. The manager is the primary link to others in the agency and the community. People that are on the front line, running activities and dealing one-on-one with clients and things like that, may not have the opportunity to speak to upper management or get word out into the community about things that they want. You know, somebody may have a special event that they want to offer for the community, you know, an Oktoberfest event or something. It may be your place as the manager to be their advocate or their lips to get the word out there that this is going to be offered. You're the one that has to deal with that. The manager articulates the merits of recreation therapy to the stakeholders. It's your job to, and this can be done through marketing, like we said. These are the benefits you can see from recreation therapy. This is why you should come see us. This is what we will do. Here's Jan. She's a happy customer of ours, you know, whatever way that you can get the point across the best. You used evidence-based practices to present outcomes. You monitor legislation, which is changes on, you know, national, state, or even just your facility level. You know, they may change the way or legislate changing the way things are done in your facility. And you'll be the one to engage in professional association initiatives. Like if there's something that needs to be shared from what you're doing to ATRA, NRPA, you know, NCTRC, any of these professional associations, as a manager, you may need to be the mouthpiece for this. So in order to do that, you need to listen to the people that work for you, and you need to really take note of what people are saying. And if you're asked to share information with someone who's higher up the chain, then it's your job to do that. Okay, that was a lot, but it was for a reason. We are through 7 chapters. Again, let me stop screen share real quick on this. Don't forget, under the content, there's the study guide. If you want to prepare, start preparing, and I think you should. Look at some of these learning outcomes. You know, I've got the PowerPoints all there, and then I also have the things that give you, you know, review questions and main terms and things like that. Those are the kind of things that will be on the test. So look at the study guide, look at those things, go back over the slides, and then we will review on Thursday and then test probably Tuesday of the next week on chapters 1 through 7. So thank you for hanging in there. I didn't see anybody actually fall asleep, so that was good. Y'all have a good day, and I will see you guys on Thursday for a little bit of review. Do me a favor and look at that stuff, though, where we can actually talk about it as a group, okay?